A new study says environmental factors may play a bigger role than genetics when it comes to autism. And here to talk about that study and what it means for concerned parents is UW Dr. Christina Iyama-Curtis. Okay, so this is a pretty big deal. They're saying that environmental factors could be linked to autism. What kind of environmental factors are they talking about? Because they don't state it, at least in the basic studies that we see.
That wasn't the point of their study, to identify the environmental factors. But we've known for a long time that there are environmental things that happen that, like drugs, like the mother takes when pregnant, like thalidomide, or
and
infections.
What is that?
It's a medicine that was used in the 60s to treat nausea in pregnancy, but turned out to have birth defect significance.
So is this study, if you were saying that they already know about some environmental factors, is this study really nothing new?
It is new. It is new because in the past we have always thought that fraternal twins who are no more genetically alike than other siblings would have the same rate of autism in each of the twins. And what this study looked at and said was that there's a much higher incidence of autism if one fraternal twin has autism, that the other fraternal twin will also have it, and it's probably 3 times what the sibling rate is. So they think that there's something in that shared prenatal environment that accounts for this higher than expected rate of fraternal twins both having autism. Okay,
so something going on within, meaning environmental factors going within.
Yeah, it's something you eat, something medication you take, or other exposures that you don't know about. But we have known that environmental factors can trigger autism. Things like rubella. So if the mother has rubella, German measles during pregnancy, the baby can have autism. So we have known that there are external factors, and there's this whole field called epigenetics that looks at things outside our DNA which can affect how our genes are turned on or turned off, that can have health effects years or even decades later.
What are parents supposed to think? Parents who might have autistic children, or parents, people who want to become parents, that all these studies just keep coming out one after the other. What are they supposed to believe? How are they not supposed to be fearful that their child is going to have autism and oh, don't touch this, don't eat that? What are they supposed to believe at this point?
So all you can do with things like medications, you always weigh the risks and the benefits. And sometimes the risks are unknown, but the benefits have to be very clear. So one of the drugs they're looking at is an antidepressant. In pregnancy, a lot of women have taken that. But sometimes the depression is so serious that it's worth the unknown risk to treat and keep the mother healthy. So you always weigh risks and benefits when you're eating things. When you're, I know that, biscuits and gravy, not good for me.
Right.
So it's, we always weigh that,
Okay. So weigh pros and cons, and then you have to really stay in touch with your doctor and just be informed about what is going on.
Absolutely.
You think more money needs to be spent on studying autism and the causes for it?
I think the important part of this study shows that because autism symptoms emerge very early in life, that these factors have to be operating prenatally or early postnatal life. So I think the shift for looking for environmental factors has to move away from what happens at 18 months or 24 months, down to what is the mother exposed to. And yes, I think more research effort needs to go into that.
Okay, Dr. Iyama, thank you very much.
Thank you so much.